Buddy, welcome to the Pain Sucks podcast, and we appreciate your patience with technology issues, which when we were little, Kate, there was no problems with technology issues because it was either the cord wasn't plugged into the phone and that was it, right?
Yeah, the tape was over.
So anyways, we appreciate you all being with us today. This is the Pain Sucks podcast, and our vision and mission is to create one local place where people can go and get all the information, details, and strategies that they need to handle pain in their life. And what we've had so far has been awesome. This is going to be our 10th episode, and I'd like to introduce you all to a wonderful friend of mine. And we've worked together for, I don't know, Kate, maybe 4 or 5 years, something like that. Yeah. And we've worked closely together. I and my wife, Jessie, are her clients and vice versa. And I really thought that this was important that we get together. So this is our good friend, Kate London, owner of London Recovery Institute in the People's Republic of Geneva, Illinois. And Kate comes to us. When we met Kate, like, her resume was just packed and loaded because of her studies and because of her certifications and what she brought to the table. And when I met Kate, I think Jessie and I were in agreement. She was like no other, and you are like no other. I hate even to use the word massage therapist because you're like way beyond that, but therapist. And I know we were so impressed, and we've actually watched you create miracles in people. And so what I wanted to do was have her on today. So Kate, say hi to everybody watching.
Hello. Thanks for having me. I appreciate it.
Kate, turn your volume up just a little bit if you can.
Let's see.
There we go.
Is that better?
Awesome. Perfect. Yeah. And so Kate, the other thing is we have a wonderful listenership, and I actually am going to tell you that if you want to see their comments, you're going to actually have to be on on your phone looking at the Pain Sucks podcast. I will, of course, relay them to you as you need it. So cool.
Yeah.
Awesome. So guys, listen, we want to jump in today because one of the things that I wanted to cover with Kate today was this idea that pain, it sucks, and people are looking for management for it. And I think that there's no doubt in my mind, right, Kate, as she changes her location. That's okay.
It's because my dog's barking. I know.
That's why I do this at the office. I think that there's no doubt in my mind that massage and its components play a massive role. And I don't know that anyone questions that. And we've seen great things that happen. Kate, just give us why is what you do with massage therapy, the other thing, why is it so important as a strategy for people that are dealing with pain?
Because your nervous system dictates strength, but it also tells you when there's something going wrong with your body. And massage therapy not only addresses soft tissue and muscles, and that's typically what people think of, but we're also addressing the nervous system. And when you address the nervous system, as you well know, you can create lasting change. So I think people don't realize how much the systems are connected and how the nervous system really drives everything.
Okay, you got to unpack that for us because that was big. Because I think probably the majority of people listening right now, whether it's pain from a disc herniation or a shoulder injury or a calf or whatever it is, I think that most people immediately go, well, I'm going to go have someone work on my muscles and let them go. Right. And I know I don't want to stereotype stuff, but I would imagine that if I polled people, that is sort of what they're thinking. So unpack what you just said, because you talked about the different systems interacting.
Yeah, they say the same thing to me. They say I have an injury and I have knots and I need to get the knots out.
Okay.
But the knots are there protecting something. So you get a knot because your nervous system is locking something down to protect you from an injury or something else. So something's going on at a much higher level, and we have to address it at a higher level. And you can't do that without putting your hands on somebody.
So yeah, absolutely. I think what I hear you saying is when people make the comment, which is a very common comment, and I can understand why they would say it. But what we're saying is that there's more to it. Is when they say things like, I think it's just a muscle.
Yeah.
Right. Or it's just a knot. Like there is no such thing as one being separated from the other. Walk us through some anatomy. Let's pick the low back, for instance. That was my story. Let's pick the low back and a disc herniation. Walk us through what you're looking for something like that and how you're tying that through to that person that goes, I'm just here for my muscles.
Yeah. I mean, I check everything. So I'm going to check your lower back, but then I'm also going to try to figure out why that happened in the first place. So I'm looking at your hips, your knees, your ankles, the bottoms of your feet, your neck, and I'm trying to figure out if it's if it's a muscle imbalance, if you've got something going on with other soft tissue, or if you've got fascia that's locking everything down. Are you dehydrated? What are you eating? What kind of stress are you under? So your nervous system might be getting low back pain because you're under a tremendous amount of stress. You sit all day at work, and then you want to go play basketball, and then you think, God, every time I start working out, my lower back hurts.
Yeah.
But and then most people would go, well, I'm just not going to work out because every time I do, my back hurts. And I'm like, but hang on a second. What else is happening to you? You have a lot of stress. You sit all day. Your hips are constantly in a flex position. And then you try to play basketball and you want your hips to then be, you want your glutes to be pushing you up into the air, and you want your body to work functionally, and it can't. Because you never train it to do that. You train it to sit all day.
Right. So you're saying that it's always multifactorial. That like literally
always.
as our listeners are listening and watching over the next week or whatever, how they're going to consume this content, what you're saying is that when they're walking in somewhere, this idea that like, I just need this one little thing worked on is never actually true.
Ever. No. And I mean, any practitioner will tell you, and this happens with you and I. I'll go in and you'll say, how are you feeling? And I'm like, I'm great. And then I lie down and you're like, well, you got 3 ribs out. And and I'm like, well, I felt fine. The same thing happens in my clinic.
Right.
I just have this one lower back thing and I just need you to release it because I need to go do what I want to do. And I'm like, well, I start feeling around and I'm like, does this muscle hurt? Does this knee hurt? Are you getting a headache? Do you feel sick to your stomach? Okay, well, now that I think about it, yes to all of those things. So you have to take in all of those systems.
So when it comes to someone walking in with pain, like in your mind, you're like, I got to check them from the top of their hair to the bottom of their toes, even though like they only marked off like maybe this one thing on their chart. There's so much more that could be playing a role, from what emotions do to one area of the body to the physical stress of life. And you just mentioned something huge, like the chemical side of life. Because one of the things that I've been doing over the last 6 weeks is interacting with people a lot on Facebook, particularly around disc herniation, and always asking me questions like, well, my massage therapist like did this and now I'm worse. And I like, we're never finger pointers because everybody's different. But you're saying is that when you're walking in for therapy of any kind, like you need to understand that the right person's going to address everything as a whole.
Right. And you might be feeling worse after you've had massage therapy because they're releasing things that weren't released before. And that triggers something else. You're never going to feel perfect. And I get that all the time. Like, how come I always have to have something done? It's always something. Well, yeah, it is always something. We're constantly under gravity. We're constantly under stress. And no day is the same, like no minute is the same. I mean, I can work on you 4 times a week and have to do 4 different sessions because your body's reacting completely differently.
Right.
So that's true. And I get that too. Somebody will say, well, I went to a chiropractor and I got so much worse. And I'm like, well, actually, you feel worse because you were really messed up to begin with. And sometimes healing can be a little painful in the beginning.
Right.
And there's a difference between a sharp stabbing shooting pain where you can't take a breath and I'm sore.
Right.
And I think a lot of people are missing that mind-body connection too. Are you hurt or are you injured?
Right.
Or has something happened to you, or do you just feel different than you normally do?
Right. Right. No, those are all really good points. And that actually leads me to the question I wanted to ask, because I do think that massage is a wonderful part of almost any strategy. Like, I think it's a part of the puzzle in almost every single case. But I think that, like you said, one of the expectations is that we're going to feel better right away. And I know as a chiropractor, and I know like in our clinic, one of our sayings is, the adjustment wasn't designed to make you feel better instantly. It was designed to make you heal better instantly.
Right.
Healing takes time. Right. But at the same time, I also know, like, just dealing with the clients that you and I work on together, is people will come back in and say, she figured that one thing out in my shoulder. And I'm like, well, what'd she do? And they're like, well, she worked on my left hip.
Yeah.
And then my shoulder got better. And that's one of the things that we just think the world about you because of the way you look. So, there's people listening right now that are like, I tried, it didn't work. They I went in for Swedish and I got deep tissue, or I went in for deep tissue and I got this little rubby dubby thing on my skin. And it, like, can you break down for people, like, what should pain management, symptom relief, goal oriented, like, what should that therapy look like?
Well, first of all, I'll tell you that same thing happens to me. I'll go in for a massage sometimes and be like, that was horrific. Or thanks for putting that lotion on me. I really needed that. Like, you got to find your person. And that's sometimes really hard. You got to see a lot of people. But it's not uncommon if you get a real therapeutic massage. It's not uncommon to feel a little dehydrated or have a little bit of a headache. And then the next day feel a little bit beat up. But by mid-afternoon the next day, you should be feeling pretty good. But at first you do kind of feel like, usually what happens is people leave and for a couple hours they feel amazing. Right. And then the headache starts, or they're like, I was kind of hungry, but I kind of wasn't. And then I always say, drink a ton of water. Like, we're releasing a lot of toxins and I want to get those out of your body. And that's why we always say, drink a ton of water. It's not because we think that you don't drink enough. Some people don't. Yeah. But, I know that I just triggered something that's going to trigger healing, but you have to help. Like, the hour or the hour and a half that you spend with me is not equal to the amount of time you're spending alone. So we have to work in partnership. And that means you got to drink a lot of water and you got to get some rest. Most people sleep really well the night of a massage. If you're not sleeping well, something else is going on. But you should be sleeping really well. And then the next day, it's not uncommon to wake up and feel like, God, I feel like I had a hard workout. That happens all the time.
And so when someone comes in, okay, so I want to talk about something that I think is a little controversial right now, because people walk in pain, and no matter what part, but again, let's focus on like with me, let's focus on this back. And like, you're looking at someone, like a trained therapist is going to notice like what splinting is. They're going to notice like protection modes. Right. So like, when someone's hurting and they're just calling the local place for the $31, rub-a-dub thing that like helps with a little bit of that. So I guess maybe like some transmitter stimulation that helps their brain kind of forget about the pain. But when someone's really in pain, what are like those first four? And first of all, you guys have to understand, like, you don't walk into her clinic and it's like a high five. Like there's paperwork, there's an exam. Like these are the type of people that need what you have. Like, what are those 4 or 5 steps that you're looking for? Because I also know, and this is that controversial thing, there are times when you're like, absolutely, I am not touching you because I am not releasing that muscle that's you think is the problem and hurting. Right. Like, there's no way that I am, like, that needs to stay there. Can you handle some of that controversy?
Yeah. I mean, like I said earlier, when you undo something, you've done something else. And when you do something, you might have undone something else. So you have to understand the process of what's going to happen when you make a decision about manipulating a certain area. Right. And the tricky part is that everybody's different. So in the beginning, I tend to move a little slower, especially for somebody who's in a tremendous amount of pain, because breathing hurts. Like, I mean, there's people who can't even make it up the stairs. Yeah. And then they like leave and they're like, okay, I'm going to lunch, I'm going shopping. And I'm like, whoa, you need to slow down. But there are people that I don't work on because they come in highly emotionally charged on top of maybe having something wrong, but I can't even get through my muscle testing. Right. If I can't get through muscle testing, I'm probably not going to work on you, because if your emotions are super high, what I do will probably make it worse. Right. Because you've kind of already decided that something's wrong with you. Not, I have an injury, something's wrong with me, and I'm not going to get better. And those people don't get better. Like, you have to come in and go, it's hurting really bad, I'm super worried about it, and give me some information, and then I can walk you through that. Yeah. Because I'm not just going to dig an elbow in there, but I have to feel around a little bit and see what's going on. Yeah. I mean, if somebody's got a lot of ribs out and then they're coming in with headaches or something like that, I can't put them back. I mean, sometimes they do go back just in a regular massage, but especially that first rib, I can't get it. I don't know how to do that's not my jam. So sometimes I don't release scalenes in the front because it's going to make the headache worse. So I leave it, and then I'll call you or call another chiropractor or tell them and say, you need to go to the chiropractor, and then you need to come back in a day.
Yeah.
Because I know that releasing that, they're going to have a pounding headache, or they're going to, you know, it's, if they have a history of migraines, it's going to trigger a migraine, or they already feel sick to their stomach. And so you have to know what you're doing is going to affect something else.
I love that you said that. That's just a brilliant comment, because I think that, and I know this from when I was just in ridiculous amount of pain, I'd give anything to make the pain go away.
Sure.
And if someone told me that it was muscular and someone could just strip that muscle out, I'd feel better. But what I've learned and what I know to be true is that the body is in protection mode for a reason.
Right.
If we're letting it go too soon, we're going to cause more problems. And I'm going to be perfectly honest. You know this. I've actually had people come in that, like, they've looked at me and been like, can I get a massage? And I'm like, yes, next week.
Yeah.
Because I have to work on your nervous system first.
Right.
Because there's nothing Kate can do through what she's fantastic at until we get you calm. And you're saying even there's people that walking in and it's like, dude, you're so highly emotionally charged.
Yeah.
I'm going to put my elbow in there, but because of your belief systems and your emotional state, the minute you stand up, it's all going to go right back, because that's exactly what the body wants to be at. And what we need to do is work with it instead of force it. Would you agree that that's true?
Absolutely. I mean, I have people that lay on the table and they are complaining the entire time. I know this isn't going to work. Nobody's ever done this. Why are you working down here? Why? And I'm like, could you just zip it for a second?
Yeah.
Like,
calm down.
I'm trying to explain it to you, but you've already decided, because you've seen 6 other people, that no one can do anything. And if no one can do anything, then why are you here?
Right.
Some part of you must believe that somebody can do something.
Yeah.
But it's such a small part that I can't get it in an hour.
And like, bring more of that like small part of you back out now.
Yeah, I need it.
Yeah. And I mean, we like episode 3, 5, like we've done a bunch of episodes about the importance of mindset. Yeah. And you're saying it works the same. If I'm just going to plop down on a table and hope that for 30 minutes I can like maybe take a nap while someone works on my back. I mean, I'm walking in pain. Like, that's probably not going to happen. And if it does, like, then I probably didn't have that big a deal anyway. But more than likely, I'm going to walk out and then I'm going to go like I see on Facebook and tell everybody why that doesn't work. And it's because I'm bringing me to that situation, and I'm not in a whole place right now. Like, I'm beat up emotionally, physically, chemically. And you're saying like, that's why when you walk in, like, we need to address you as that. Like I'm going to calm you down. We're going to get your mindset right back. Then we're going to start working on those areas that are tolerable today. Like, which ones are okay to let go today. And when you walk out, you may not be like, I love you, I feel better. And that's okay, because we have to peel the onion layers of this, you know, decade old thing that you've been building. Yeah,
absolutely. I mean, it can be transformative if you let it. I've had a handful of patients who they come in and they're like, oh, I have a headache. I always have a headache. And I'm like, well, what's always? And then I get the eyebrow, like, I said always. But and to them, they do always have a headache, but they also can't tell me where the headache is. Is it back here? Is it up here? Is it on the side? Like, do you feel it in your neck? I have a million questions. And they're like, can you just get rid of the headache? Well, no, because once they lay down on the table, they start complaining about their sister, their kids, their mother. And then I'm like, that's your headache.
Yeah.
You know, your headache is, and then they leave and they're like, oh my God, my headache's gone. And I'm like, you need a therapist. Like, you don't need a massage.
Or you need both.
Maybe a little bit of both. But
so there are times when you literally are like, I can't, or maybe I won't be able to like let this area go because there's an underlying thing that you need to work on. But and we get that. But like so like then that person walks in and you're like, this is great. Okay, so you've been down for the count for a month. Like, you found your way over here. When someone goes to find a massage therapist or a therapist like what you do, what are some things that they should be looking for on the website or a phone call that they make? I mean, I'm talking about that person, not the person who's just sore from tennis all week. I'm talking about like that person who's like hasn't slept in 5 nights. The pain is ridiculous, or like who are like, I have no problem sending all of those people your way.
Yeah,
But like,
you do.
there's people watching it from around the world. Like give them some strategy. Like, who are they looking for? Like, do you know what I'm saying? Like the $4 place probably isn't the right place, but it could be. Like, what are those things that they're looking for?
Well, you want to look for somebody who's had a lot of experience across different modalities. So if you see somebody that's like, I do Swedish and deep tissue, they're probably not your person. You want somebody who's had some therapeutic background and has worked with all populations. It takes a really long time to figure out what good tissue feels like and what toxic tissue feels like, or a muscle pull or a strain. You just have to put your hands on a lot of people. So somebody who's like, well, I've been doing this for 20 years and they're like, I do Swedish, that they probably do a great massage, but it's not therapeutic enough for you. They're probably not. Those people have a routine. So every time you go to them, it's going to be exactly the same. But when you come to somebody like me, it's not. So I would ask that person, do you do the same massage on everybody? Are you looking to solve the problem, get to the root of the problem, just make me feel better? They should be able to tell you. I always tell people, our goal is to get to the root of the pain. I'm going to figure out where it's coming from. And it's not always comfortable, because I'm poking around and it hurts a little bit. I always, once I get into hips, people are levitating off the table and I'm like, I didn't even do anything yet. So then I know that that's a problem. And the place that doesn't hurt, or the pattern that doesn't hurt, that's the one that's usually causing the problem.
Interesting. Say that again. The one that's not hurting is usually the problem?
Yeah. Or the muscle pattern that's not hurting. If you're, say I have you lie on your stomach and I have you lift up your right arm and your left leg, and you're like, yeah, no big deal. And then you're like, but my problem's on my right side. Yeah. And then you lift it and you're like, see, that's where it hurts. That's probably not the cause. I'm going to check the good pattern, because it's like the good pattern is the criminal and the other pattern's the victim. The victim screams. So the right-hand side's screaming because the left side's causing a problem.
Right.
So if you don't have a therapist that's looking everywhere, then you don't have a therapist that's going to solve your problem.
Yeah. No, I love how you say that. And again, we're not throwing anyone under the bus. It's
not
just
at all.
simple. Like, if the goal is to get to a certain level, then that you got to find that person. So if I'm looking online and I'm in an area where like I don't really know who to look for, I mean, are there hints? Are there things that give it, or are you just okay with people calling and being like, hey, I got some questions?
Yeah, they can call
about what you do and how you like. Are you going to examine me? Are we going straight to the area of pain and you're spending 30 minutes? Like, those are good questions.
Yeah, those are great questions. I always look for people who also have either a kinesiology or a physical therapy background. Someone who does fascial stretch therapy probably has a bigger medical background. Those people are going to look around because they're used to looking around. I tell everybody they should get a massage anyway. I don't care if it's Massage Envy. Like, you should just get some work done, because even going to Massage Envy once a month or a place like that, your nervous system is still going to get what it needs, whether it's that soothing, calm. I'm fine with that. But I wouldn't go there if you're recovering from surgery or from an injury. You need to see somebody who knows what they're doing.
So those are big words that you used, and I know that you can likely find those on people's websites, and you're starting to get a pattern of like, this person is like highly trained, this person has the history, this person probably can unwind a complex injury for me. And I love that. And that actually helps me transition to the next thing. And this is where I want to spend the last few minutes, is that I think that one of the things that's super important that I've been kind of coaching people through around the world is like somebody that's got a whole lot of different things in their toolbox is going to be your best bet. And one of the things that I love about what you do is, if I go on your website, there's distinctions and accreditations that I can't pronounce.
Yeah, that's
which is amazing. And then like patients of yours and mine will come back and they're kinesio taped to the gill, and they have these discs all over them for glutathione and pain relief, and like these things all work so darn well together. Would you share a couple of those other strategies that you do in your office so people can kind of look around?
Yeah, I use the discs.
What are they?
Amino neurofrequency discs. So
okay, you got to unpack that.
I know. So
Okay.
they work with your nervous system and the chemical composition of your body, and they emit a low radio frequency that changes the vibration level of the cells they're targeting. So, for example, I have discs for pain and inflammation. If I've got an area that I need to get into, or that I do get into, a herniated disc, and I need to work around it, but it's super painful everywhere, then I'll put a disc right over that herniation, and it changes the vibration of the cells in that area. It brings it down so that I can then work in that area. And then
Right.
the disc stays on for 3 or 4 days and keeps that area at a lower frequency so that it's not going crazy. It tells the nervous system, I'm working on it. Stop sending signals down here.
Yeah.
Knock it off. And the tape does the same thing. I tape for a couple reasons. One, to kind of reinforce the work that I've just done, and to create a little bit of stability and to decrease inflammation. So again, if you have a herniated disc, I'll probably tape your hips as well to give you a little bit of stability. And some people say they feel it. I know I feel it when I get taped, because you're taping the top of the upper glute and glute med on either side, and you're going up the sides of the spine, like part way. And it does, in your mind, it creates a little like, oh, if I move, I feel the tape move. So it helps slow things down a little bit and creates a little stability. But mostly your nervous system is like, oh, I need to stop sending pain signals down here. You're doing something to help me. Okay, I'll go do something else now.
And when you say taping, you're talking about kinesiotaping, right?
Yes.
You break that. So unpack that a little bit, because I know that I have discussions with people who think that taping means that they remember like when the high school trainer threw the white tape on their ankle before the game. So completely different. Walk us through kinesiotape and its importance in pretty much all injury.
Yeah, kinesiotape is stretchy. So it moves with your body. We're taping movement patterns. I'm not taping your ankle so it doesn't move. I'm taping, if I do tape your ankle, it's because we're trying to create a different pattern, or I've released something and I don't want it to lock down again.
Right.
So the kinesiotape is stretchy. You can wear it for 3, 4, sometimes 5 days through the shower, the whole thing. And it decreases inflammation, and it allows that muscle pattern to keep firing without me having to go back in every 5 minutes and retrain a muscle.
Yeah. And I think when I learned a lot about kinesiotape back when it was first invented and kind of coming to the public, some of the things that people don't get is like it's pre-stretched on the backing so that when it lays on your skin, it actually pulls the areas of the skin where the tape is together and creates actually a vacuum under the skin. So osmosis, for those of us that haven't blocked out completely chemistry, understand that when we create a little bit of an environment and an empty space, the body wants to bring healing energy to that area. And so kinesiotape helps, like Kate said, with inflammation in that form. It's just enough information to the skin to give the body a little bit of structural feel, like a support. And then the last thing it does is it just really stimulates the crap out of the receptors on the skin, and it tells the brain to calm down.
Yeah.
It's really one of those tricks that, like, when people reach out to me and I can't, I'm not near them. They could be around the world. And I'm like, put some kinesiotape on. Like, it's all over YouTube. I mean, you don't have to be an expert. You got to get to Walgreens, right?
Exactly.
The thing is it's a really wonderful tool in the mid time to help you. Like, if I go back to my notes, when you first started, you said, when you undo something, you do something else. Well, kinesiotape is one of those things that allows you to begin the process of undoing without like the damaging side effects of other things.
Right.
And it also helps train multiple systems at the same time.
Exactly. And that's why I like it. The other little trick I use with kinesiotape is to put it over a scar, because scars are really damaging and we don't realize how damaging they can be. So if I muscle test something and I'm not getting the response that I expect, and I've done it a couple of times, I'll be like, do you have a scar anywhere? Oh, I have one on my foot, but you're testing my shoulder. I'll throw a piece of tape over the foot scar, and then I'll retest the shoulder, and it tests strong again. Yes. Your body's constantly sending those messages, and we just don't think of it. We're like, it's a scar, it's no big deal. But when you're really trying to drill down to the cellular level, You got to check everything.
Right. And so it's not like, again, we just keep coming. We've been hammering this thing. It's it's always multifaceted.
Yeah.
So much that has to be looked for. And I love this conversation. So the discs that you talked about, I mean, they're just like little round, shiny discs that, right. And how do they adhere to the body?
They have a antibacterial tape on the back.
Okay.
And you just stick them on, and the heat from your body kind of activates them, and then they start to shift it sounds like voodoo. They start to shift the vibration of the cells.
Right.
And really, like, when you start talking about glutathione and gut health, and I use them a lot for vertigo.
Yeah.
Stuff like that. When there's a system that you can't get your hands on, the discs are really helpful, because when that system calms down, I'll get information from another system. So then I'm like, oh, that really isn't hurting you. Yeah. It was just that this thing was so crazy. It started triggering all these. It's like every light in your car coming on at the same time. Yeah. The disc is like, okay, the brake light's off. The check engine light's off. Yeah. The coolant light is off. And then it's like, now what's really going on?
Right. But at the same time, you're now finally getting to that root cause that you talked about.
Yeah, exactly. And then you can treat it. So if the discs work for something, then I can say, like, you need to talk to somebody about what's going on in your gut. Like, what deficiencies do you have? You need to get some blood work done. And I mean, not by a regular doctor. I mean, by somebody who's going to look at way outside the reference range and see what you need for your body based on the way that your lifestyle is. Because these, and I have this, like, I have a handful of people that come in that are like, well, I'm a health coach. That's awesome. But you're not a functional medicine doc. And I know you're feeling better, and that's great, but that doesn't mean that what you've done is going to be good for every person that you see. And I see that with trainers. I see it with health coaches. I see it with wellness coaches, life coaches. Everybody's like, look, I did it. Let me show you what I did, and you can do the same thing. Mm-hmm. It isn't like that. Just like my clinic isn't like that. Mm-hmm. Every day it's different. Every person is different. And there will always be something that needs to be addressed. Your gut might be amazing your whole life, and then you turn 40 and it's a disaster. Mm-hmm. And then you take a couple years and it gets back on track. But think about it, like, your hormones are always fluctuating. There's stress coming in. There's environmental stress. There's all kinds of things happening. And that is going to trigger a response in every other system of your body.
Including the muscle systems.
Absolutely.
And the joints and all that.
And they're really last. Like, in the hierarchy of change, like, you're coming in for muscle and soft tissue, but that changing that doesn't solve your problem at all. It's last on the list.
You're saying that the pain that they're being interpreted in their muscles and whatnot is the last thing to show up.
Correct.
And that by just maybe sort of removing that tiny little layer, you've left all of the cause underneath.
Yeah. And so you'll see people who are like, I've gotten a massage every 2 weeks since I was 16, and they're 40. And I'm like, no, still kind of a mess.
Yeah.
Like, and every time they come in, it's like starting all over again.
Right.
And it's hard on everybody. Like, they're frustrated. I feel like I'm wasting my time.
Right.
And it just never gets better.
So and I would say that's kind of a human condition at the same time. Like, we all probably suffer from that idea of recognizing that the surface layer is not everything, but we just like stop there in a lot of cases.
Yeah.
And so what you're telling me is what everybody else is telling me, which is that for the people that are listening to this and they're just really hurting, it's like, hey, go on some websites, find these discs, find a therapist who's using these discs, who knows how to tape, who's going to, check your big toe, even though you have a herniation in your cervical spine. Like, but at the same time, like, understand that that's just part of the puzzle.
Yeah.
That, like, you should be walking in there already figuring out how to address an unhealthy lifestyle, already figuring out how to address the emotional states and some of the things like that Dr. Mick, Dr. Jim, and Mandy have talked about on the podcast, like that all together, plus of course the biggest one, which is just time.
Yeah.
Right. That they'll work. So let's so I know your clinic is obviously localized here to, and you haven't figured out how to do your work over the phone or Skype yet. But give us some last just couple parting words here for some folks that are like watching and who can't sit right now. Maybe their backs are so bad. What are they going to look for when it comes specifically to what you talked about today? Give us a couple of parting moments of health and hope.
What they're looking for in themselves?
No, what they're looking for to find someone in their area that can help them get themselves back.
Yeah, I would say
because they can't fly to you. Although you'd be okay with that.
Yeah, if they want to fly me out, I'm happy with that.
Yeah, right, exactly.
But they'll have to fly you too, because I know I'm going to need help.
Right.
I would pull up, and I know this is a big word, but I would pull up kinesiologist.
Okay.
I really would, because I think if you can find somebody who understands kinesiology, and you'll probably end up finding a physical therapist or that sort of thing, start with them, because even if they can't do it, they're going to have a network of people that they can send you to.
Right.
Because we all kind of we all have a network where we share people and ideas and things like that, and share patients. I got an email this morning from a PT that said, they had somebody with a torn meniscus and she doesn't really want to do PT. She wants to do something in the middle. And she said, "You're in the middle." And I was like, "I am in the middle." So, but she wouldn't have known that had I not known that PT already. Okay. I would start there. I would stay away from large health organizations that are just going to take insurance. I think probably the people that you're going to find, and I know this is controversial too, some of your best practitioners are not going to take insurance. Yeah. We just can't afford it. And they would pay us $7 an hour and we couldn't afford to keep the doors open. So I do feel like I get a lot of people who go, "Well, I would love to come to you, but I have really good insurance, but you don't take it." It's like, it's not entirely my choice. Massage therapy is not part of an insurance plan. And I don't know that what you're going to get under insurance is really going to help you.
That's a very interesting point.
I just feel like I would rather see you for 3 visits and pay a few $100s than see you for 20 visits and you don't have a copay. You don't need to come in that much. A lot of the healing happens on your own. We're here to help you, but we're not here to do it. I get all the time, "Well, can you fix me?" No. Right. I can send you down the path. Right. But you've got to there's so much work that has to be done on the patient side. So you have to know if you're talking to somebody who says, "Yeah, I can fix it, come in," you're talking to the wrong person. So if you get involved in a conversation where somebody's like, "I do this all the time, come on in," hang up. They're not your person. You want to find somebody who's going to work together with you and who's going to listen. Sometimes people sound like they're not listening. It's because we hear the same thing over and over again, but we really are hearing what you're saying. It's just that in our minds, it's just giving us more information for a path that we've already kind of decided we're going to go down. So we are listening, but we're all going to do the same check for everybody at the beginning, the same testing, the same everything. So it's not that we didn't hear you, but you want to look for kinesiology, biomechanics, physical therapy. Obviously you want somebody who has a license. And how important is and then because I hear what you're saying, and there's just so much to that, partnering with someone that's hurting instead of and leading them instead of instead of trying to think you're the one doing all the work for them and they're better because of you. They're not. They're better because of them. Right. And so kinesiology, biomechanics, some physical therapy stuff you love. I know that you absolutely love the discs. I know you love the fact that someone could be a kinesiotape expert, someone that's a guru at that, knows what they're doing with those things. And so, guys, when you're looking around because you have some issues, everyone's got a website now. If it's a standard website, there's not much to it. Give them a call. But a lot of these people that are really, really good, they've got the information there. And Kate just threw out some really important words at us. So, Kate, Jess and I love you to death. We know you keep us going, especially Jessie, and she's one of your biggest cheerleaders. We love you to death.
And thank you for being here on the podcast. Is there anything that you want to tell anybody on the way out here?
No, thanks for having me. I appreciate it. Yeah, I mean, I think my the biggest thing I would say is that you have to work in partnership with your providers.
Right.
You can't expect everybody to heal you. You got to really
team effort.
Yeah, I mean, you really got to commit to it.
That being said, I also want to have to share like a little bit of bad news, and that is that Kate is actually moving on to a new profession and new, but Kate, some of the other, I know it's not right away. So guys, if you're local listening to this and you're like, darn it, I got to catch her before she's done and turns me over to like maybe someone she's trained. Kate, are there some places that people can find you and maybe some information, or maybe even just like, hey, go find someone in your area whose website looks like this website or whatever, like where can people give us some contact stuff?
So my website is londonrecoveryinstitute.com.
Okay.
And that's probably a good one to look at, to see if you look at somebody else's website and it doesn't look like they have a lot of information.
Yeah.
Maybe they don't have a lot of information.
Your website's excellent, actually.
Thank you.
I mean, there's a lot of great information. So I would encourage people to look at that as a way to go. Is there a way that is your email through the website if someone wanted to throw you an email? Okay.
Yep. It's kate@londonrecoveryinstitute.com.
Okay.
And we're on Facebook and Instagram and stuff like that. So you can, and the phone number's on there too. So just call.
And one of the things we've asked of everybody that as you're listening is if you do need, like, if you do want to reach out to Kate, whether to make an appointment if you're close, or maybe you have a quick question that isn't going to, take her hours to answer, but you just want to opinion on something, just make sure you put pain sucks in the subject line like everybody else. That way she knows that this was about what we did today.
Yeah.
And all right, guys. Well, thank you for listening to Pain Sucks podcast. Remember that absolutely no one gets to tell you that you can't heal. And that, this is all about recovering your hope and getting back on track so you can live the best life possible. Thanks, Kate, for being with us today.
Thanks for having me. I appreciate it.
Bye-bye.
All right. Bye.